I would say what excites us most about the essentials, and it's myself and the faculty, are that they're transformative. It's a chance for us to look at our curriculum not in the past, but look forward thinking. What do we need to prepare our nurses for the future? And I think it gives us an opportunity to have permission, if you will, to go ahead and do a bold curricular revision. We won't be making minor tweaks to the curriculum, but we see this as an opportunity to sort of blow it up and start over from scratch. So I think the essentials are liberating in that way, that we can go ahead and really transform our curriculum to be something that will prepare people for the future. I think the other thing that I see as really exciting about this is that it's a way for us to finally make attempts to bridge the gap between academics and practice. We've talked about it for as long as I've been in nursing, and I see the essentials as a way to finally get some traction in bridging that gap. In terms of how we engage our practice partners, we're really at the early stages in our work with the essentials. We're actually taking an approach where we're going to take all of those competencies and sub-competencies and we're going to classify them. They're either knowledge for practice or they're knowledge in practice, and we're going to engage our practice partners in that early assessment and categorization. That's going to give us guidance as to whether this is something we'll focus on in the clinical setting or in the classroom setting, or if it's something that's going to span both settings. So that's how we'll engage our practice partners in the early stage, and then our plan is, and we have a 3-year implementation plan. At the end, we're going to engage with our practice partners and say, what are the competencies and sub-competencies you're really looking for in the graduates? And that's what we'll focus on toward the final semester of our program to make sure our graduates are practice ready. We've done our curriculum mapping, which I think most schools have done. And we're adopting a model, the Competency Outcomes Performance Assessment Model. It's been around since the 70s. Carrie Lenberg created that model. But it's a 4-phase model, and we think it really fits well with the new essentials. It focuses on what are the competencies for contemporary nursing practice, and many thanks to AACN for identifying those competencies for us. What are the indicators that best define those competencies? What do you have to teach to make sure people are prepared for those competencies? And then how do you assess those competencies? So we're using that approach in terms of how we're going to structure our work with the essentials. I would say in terms of tools and strategies, obviously all the mapping tools that are available have been very helpful to us. We actually had an existing mapping tool, so we just revised that a little bit to include the essentials. So we're able to map our current curriculum to the essentials. That gave us a sense of where our gaps are and where the essentials could fit within what we're doing now. But again, we're taking that approach that we're really not interested in just making minor revisions to what we have now. We want to transform and come up with something new. So those tools were very helpful. We see the tools from the Competency Outcomes Performance Assessment Model to be essential to this. We're going to develop elements of performance for every sub-competency, which sounds like a daunting task, and it probably will be, but we're committed, and then those elements of performance become our evaluation criteria for each of the competencies. So the faculty can use those to construct their assessments in the classroom setting, and then we'll use those as our assessments in the clinical setting as well. We think that this is going to make evaluation and assessment actually something that's not dreaded, but it's something that both students and faculty can embrace.